So, Dr. Snyder, thanks for having us today. We appreciate it. You've been in the studio to talk about breast reconstruction surgery in regard to breast cancer patients, but tell us about more elective versions of that surgery that you do here.
Sure. So lots of options for breast surgery in terms of cosmetics. Maybe the most common of those being breast augmentation, so enlargement of breasts. But in addition to that, there's a lot of other things that we do, breast lifts for one, or mastopexy as we call it, and breast reduction. Probably almost as many people who want to have their breast enlarged want to have their breast reduced in size. So I guess there's kind of always a joke that everybody with smaller breasts wants bigger breasts, and people with bigger breasts want smaller breasts.
What about facial procedures that you handle?
So yeah, we do a lot of facial rejuvenation. So facelifts, so they're even within that, there's a few different subsets. So there's some mini facelifts and there's neck lifts. There are things, and some of these may depend upon age and how much facial aging someone has as to what procedure they may get. But there's a lot of options in terms of surgical facial rejuvenation. And there's eye surgery too, which is part of that. So upper eyelids and lower eyelid rejuvenation.
Yeah. Really important to get consultation with you, because you might think, oh, I want this, but it might work best in tandem with another procedure, right?
Sure. So sometimes people are focused on one thing, but I think the face has a lot of components that all have to be in sync with each other. I suppose if someone had a lot of age look around their eyes and the rest of their face was youthful looking, that we might be missing the point if we don't sort of address everything, or don't at least consider addressing everything.
Yeah. What about other procedures on the body that are popular that you handle?
So sure, a lot of body contouring options. So the simplest of those is non-surgical kind of options, like something called cool sculpting, which is just freezing the fat, which is great for problem areas, like guys with love handles, or whether that's outer thighs or saddlebags, and a lot of women, sometimes it's belly, it's different places, but it works great and is something that really has no downtime. Versus liposuction is kind of the next step up from sort of addressing those areas. But if we've got a lot of areas that we want addressed, sometimes it might be more practical to think of it surgical as opposed to non-surgical. And then tummy tucks, so mini tummy tucks and full tummy tucks, or abdominoplasties as we call them, that may address loose skin. A lot of that's after pregnancy, but sometimes after massive weight loss, or other things that address both fat and skin.
And I know the comfort and peace of mind of your patients is most important to you. So make an appointment and come and just have a chat with you about the possibilities, right?
That's right. That's right. I think that's really where you start, is just sort of expressing what you don't like and what you want changed, and then we sort of come up with solutions.
Yeah, a tailored plan. Thank you so much. We appreciate it.
You're welcome. Thank you.
And Snyder Plastic Surgery Breast and Body Center of Austin has locations in Austin and Round Rock. You can call 512-533-9900 or go to breastandbodycenterofaustin.com to schedule an appointment.